What are some of your frustrations as a pediatrician caring for these medically vulnerable children?
Thank you for that question because it's not easy. Um, from the get-go, getting the right space to see the children where it's, where there's a process where you can get them in and get them out, bring the services to them, minimize that exposure, minimize that waiting time, and then actually have that quality time to address all their needs and the needs of the family. That is tough to come by because our schedules are so that what people want us to do is to see patients every 10-15 minutes, crank them out, the high volume, and that's where the focus is. Unfortunately, that's misguided and it doesn't work for this group of children. If you spend the time and optimize that care of that child, it may take you an hour, and yes, you can only bill that much for that hour, but children with medical complexity, they're only 6% of the pediatric population in the United States, but guess what? They consume 40% of all healthcare dollars for pediatrics. So that's huge and that's significant. Yet there's not really an interest in this community to really case manage these children, to have better health outcomes, to cut down those hospital visits, so they're not as expensive. It's a win-win situation, but I hear over and over again that you have to see a high volume of patients to make ends meet. So if you put that in perspective, if there's one less hospitalization for one of our special kids, that's hundreds of thousands of dollars.
Saves.
So why aren't insurance companies and healthcare executives and hospitals and CEOs, why are they not excited and committed to this group of people?
And would you say, like, when you were mentioning about, like, just the state of the rooms and things, like, there being enough space for wheelchairs, space for equipment, space for parent with the equipment?
Yes, yes. And I've had some, I would call them non-offers of, well, you like to take care of children with medical complexity, so we'll give you a half an hour in between all the regular patients, the regular healthy patients that you could crank out for us,
But we know that it does not take 30 minutes,
No.
because just for my children alone, it takes hours because of the behaviors.
But regardless, your children have been healthy.
Yes.
And how many hospitalizations has Brooklyn had in the past year?
0.
And prior to that?
Like every other week.
Okay.
Yes.
So is that cost effective?
It is cost effective for me and for everyone else.
Which child loves being in the hospital? Which parent loves to be in the hospital with their child? Nobody does.
Then you have to remember the time of being in the hospital, especially if it's out of town. You have to deal with food, you have to deal with a place to stay, you have to deal with all of those things, because if you can't stay at Ronald McDonald House unless you have a referral,
Right.
and
It's expensive.
it's expensive.
You can't work.
You can't work, so
Mhm.
you're pretty much just stuck.
Exactly.
Not to mention, when they take parents by ambulance to a children's hospital and don't remember the fact that they left without clothing, without their car, and they have no way back.
Yeah, it's terrible. It's terrible. I've had many conversations with healthcare executives, healthcare organizations, insurance companies, clinic administrators. And I really feel that our group of kids really just fly under the radar. There's not interest, there's not a commitment, there's not even awareness of what it takes to properly care for a child. And there's definitely not an awareness that this is actually cost effective.
Yeah.
The knee-jerk response is, oh no, you can't see 8 patients a day and have us pay you for the work. So to me, that's hugely frustrating, you know?
Yeah.
It's sad, the quality of care that we are providing at very huge expense to our special needs children in Kern County.
Agreed.
We have hospitals from elsewhere who have a presence here in Kern County. And Kern County has been good to them,
Yeah.
because it's our referrals
Yep.
that support these hospitals.
Mm-hmm.
It's the inpatient admissions, especially intensive care admissions, that
Yes.
are very lucrative for these
Yes.
hospitals.
Mm-hmm.
Yet, they don't have the funds, apparently, to commit to taking care of the same group of people,
Mm-hmm.
to keeping them healthy
Healthy.
in an outpatient basis,
Mm-hmm.
right?
Mm-hmm.
So where is that investment in the community?
Yeah. And that's the point of us bringing awareness.
Yes, it's really frustrating.
Yeah. Someone has to save the families.
Well, it's gonna be a group effort, and there are many wonderful individuals
Mhm.
in different departments
Come together.
who come together more as a ragtag group to support each other and to help support these families.
Mm-hmm.
But the silence
Yeah.
from the healthcare industry is deafening.